Live from Denver 7, this is 7 News.
Up next on 7 News Saturday morning, the local medical clinic filling the gap in providing health to young people. Welcome back. The rate of children living in poverty in Colorado has increased by 50% from 2000 to 2008, and that compares to a 6% increase nationwide. This is all according to a recent study from the Kids Count Datebook. Now, here are some of those health problems that come with children living in poverty: malnutrition, lack of vaccinations, premature death, exposure to illegal drugs, along with poor oral health and fatigue, often a result of a poor diet. But there is some help for those kids here in the metro area. It's called the Rocky Mountain Youth Clinics, and joining us this morning is Dr. Larry Wolk. Dr. Wolk, thanks so much for coming in.
My pleasure.
I understand the need is up this year. Can you talk a little bit about that?
Well, I think with the economy, we see a lot more kids from families that really are in need of everything from health care to food to clothing to shelter. So we're seeing quite a big increase in the demand for our services.
And again, Rocky Mountain Youth Clinics, what types of services do you offer there?
Well, the Rocky Mountain Youth Clinics are really a private practice of public health. We are a doctor's office, a clinic that provides healthcare services, but we define healthcare pretty broadly. We provide nutrition, we provide food, we provide bike helmets, we provide all kinds of things that contribute to improving a child's health.
And what's the criteria for the patients you serve?
We see all kids, regardless of their family's ability to pay, regardless of the family's insurance status. So we see children primarily who are uninsured or publicly insured through Medicaid, although parents with insurance also bring their kids to us as well.
So it is kind of a one-stop shop for just about anybody, and the nice thing is nobody will be turned away?
Nobody will be turned away, and again, we do try to be a one-stop shop and provide all kinds of things related to a child's health.
And let's talk about another issue related to a child's health. I know that the Senate just passed a child nutrition bill. Do you think this legislation is going to be effective in combating children with health problems?
Yeah, the legislation is pretty exciting because it's the first time in 30 years that changes have been made to the school lunch program legislation. Rocky Mountain Youth Clinics are also in schools, so we see firsthand how kids are fed in schools and how they're taught in schools, and it's pretty exciting for us because now there's a consistent message where kids will get better nutrition in the schools, as well as what we're doing to provide better nutrition in their homes.
And not to mention the educational component that comes with that too, by providing those good choices and educating them on what makes a good choice, hopefully will help serve them for the rest of their lives.
Absolutely. Again, the consistent messaging is what's most important. And kids who are healthy learn better. Kids who learn better are more productive members of society.
Wonderful. Well, Dr. Larry Wolk, thanks so much for coming and shedding some light on Rocky Mountain Youth Clinics. If people are interested in learning more about you, is there a good place for them to go?
We always direct people to our website, www.rockymountainyouth.org.
All right, and as usual, we usually link those websites to ours at thedenverchannel.com, so it's real easy for you. You can log on to our website and click on the big red TV button for a link.